dating game. I'm your host for this evening's show, Albumin. We're here with Lady Edema, who's about to give us her choice for her perfect date between our three most eligible genome bachelors. All right, before the break, Lady Edema asked our three bachelors some very intimate questions. Let's take a look back.
Now we'll start with bachelor number 1. Tell me, why should I choose you?
Well, you can't live without me, baby. You'll come to know that you can't breathe without my hydrostatic pressure. Just call me Hydro. I can bring you special nutrients and oxygen. Everything needs oxygen to survive. Your blood, your bones, your brain, your kidneys, your heart. You can't live without me, and I would be jealous if you tried.
Okay, how about you, bachelor number 3?
Without me, baby, you'd have too much trash in your interstitial space. Without my osmotic pressure, baby, you'd be full of... Well, what I mean is, you need me to do what no one else can or will do. You need no one else but me, baby. Just call me Osmo. You know, like Cosmos, 'cause we'll be in heaven if you choose me.
Lady Edema, Bachelor number 1, hydrostatic pressure, and Bachelor number 3, osmotic pressure, are bad for you. When you choose Cardizem, that's me. I'm planning on relaxing your heart and making all your problems go away. I block the calcium channels that are present in the heart and blood vessels. I dilate the coronary arteries and can be used for angina pectoris. I can also reduce your blood pressure and control supraventricular arrhythmias.
Bachelor number 2. If you were a generic medicine, what would you be?
I'm your number 1 generic, baby. You can call me Diltazem, but I want to be a special brand for you, sweetheart. So call me by my trade name, Cardizem, because I'm all about the heart, and that's why I'm here.
Okay, bachelors, this is funny. Let's assume you're medicines from here on. How do I take you, and how often?
My Cardizem oral absorptions take place as my particles move from the GI tract to body fluids.
Assumptions? Oral? Oral, you kidding me? If you want to push that direction, that's Hydro's department. Fast forward, baby. I thought you'd never ask. I'm pushy, remember? Lady Edema, you can take me summertime, wintertime, anytime, all the time.
No, take me. All you need with Osmo is a smile. Take me in the morning, take me in the evening, take me at supper time.
Are you kidding me? I'm crushed.
Absorptions, not assumptions, you pressure heads. No, ma'am, Lady Edema. What I mean is you can take me orally, but please, you should never crush me.
Excuse me?
Better put, just take a Cardizem capsule of 180 to 240 milligrams per day of me, and I can put your heart at ease for as long as your doctor prescribes me.
Okay, bachelor number 2, why would I even want to take you? What's your classification?
Look, Lady Edema, you exist because of an increase in capillary permeability. This is because hydrostatic pressure, is always getting high. This makes your blood pressure go up and hydro gets out of control and starts losing proteins. This alters the capillary fluid content, whereas osmotic pressure, Osmo, can't even support you anymore. Unfortunately, Bachelor number 1 and number 3 are just not good for you. You see, I don't get high, but instead, I'm a non-dihydropyridine member. You see, I'm Cardizem. You may have heard of me. I'm in the PDR, you know, the physician's desk reference, as a calcium channel blocker.
Okay, again, bachelor number 2, what are your 3 worst qualities, and will I experience any side effects from our time together?
Well, Lady Edema, I have to warn you about me, baby. Cardizem could cause you to faint, slow your precious heart, and sometimes I've even been known to cause 2nd or 3rd degree AV block. I've also been known to make women dizzy, cause headaches, but mostly get flushed and get that tingling feeling.
All right, Lady Edema, from the answers you've heard, now you must select the best match for you. Our eligible genome bachelors over there are always intent on winning. Which one gets the date?
Well, Albumin, I choose bachelor number 2, Cardizem.
for a word from our sponsors.
If you plan to take Cardizem, please inform your doctor if you have kidney disease, liver disease, congestive heart failure, or if you are taking clonidine, aspirin, or Buspar. Simultaneous use of calcium channel blockers and beta blockers is contraindicated, as their negative intropic and negative chronotropic effects are synergistic, which causes myocardial depression and bradycardia. Other contraindications include pre-existing heart block or sick sinus syndrome in the client without a pacemaker, Will-Parkinson-White syndrome, and heart failure. The nurse should carefully monitor blood pressure and heart rate and rhythm after administering IV Cardizem. Arrhythmias, bradycardia, heart block, and hypotension may develop. Cardizem can elevate serum digoxin levels, predisposing the client to digitalis toxicity.